All right, so we are back, and October is National Breast Cancer Awareness Month, and joining us now is Dr. Lori Medeiros. She's the medical director at Rochester Regional Health Breast Center, here to talk all about screenings, recommendations, signs and symptoms, things we need to look out for as women during this month and really all year long. One of the first things I want to ask you about is the importance of self-breast exams.
Right.
We met a woman yesterday who said she detected her cancer through a self-breast exam, and we've heard this time and again. It's like a broken record, but it's important, isn't it?
Yeah, it is. I mean, there's a lot of controversy about breast self-exam. I mean, there's a lot of controversy about screening in general, and it gets so confusing, I think, for us when we're trying to kind of weed through that.
Yeah.
But it's important to know mammograms are our best tool, but they're not foolproof. So an average mammogram can miss up to 20% of breast cancers, and if you're in one of the categories that's considered dense, which 50% of women have some degree of density in their breasts, that rate can go up.
Dense breast tissue.
Dense breast tissue. So, one thing to be aware of is if you do have dense breast tissue, that mammogram, you still should be getting it, but it may not pick up everything. And even if you don't, a lump is really nothing that you would want to ignore.
Yeah.
Most of the time they're benign, which is a good thing.
Right.
But still worthwhile checking. Yeah.
And can you talk about the gene? Because certain females, or not just females either, but there are males that are affected by this disease as well.
Yeah, there's 1,600 males a year in the U.S. that are diagnosed with breast cancer, so it's not super common. But when you're looking at what you want to do in terms of how to be proactive in preventing or early detection of breast cancer, family history is very important. So when we talk about the gene for breast cancer, it's really kind of an umbrella term. So there's multiple genes that can be involved in breast cancer. We've all kind of heard about the BRCA1 and 2, the Angelina Jolie gene,
Right.
But there's other risk factors too. So when you're finding out about your family history, you want to find out about things like breast cancer, obviously, ovarian cancer, other female cancers, but there's other cancer syndromes that also go with things like sarcoma, which is like a soft tissue tumor, melanoma, prostate cancer, pancreatic cancer. These are all things that we don't think of commonly, but they're worthwhile knowing about. So, when we're looking at family history, what we're looking at, these genes aren't additive. So sometimes I have people come in and say, oh, we've got cancer on my mom's side, cancer on my dad's side. So really what we're talking about genetically is a lineage that's either coming down through the mom's side or the dad's side. So you want to have that conversation about, your aunts, your uncles, your grandparents, as far back as you can go, recognizing that for most people, family history is difficult, Many people really don't have a great sense of what exactly it is, but whatever you have is better than nothing.
Take it seriously.
Right.
So then there's that gene connection. We know about that. But the treatments for breast cancer today are very different, and I know we've discussed this in times past. A lot of times, we used to think that radiation was the only way.
Right.
And it is, but one way.
Yeah, it's one way.
But there are many others. There are treatments that are new and different ways of treating cancer.
Right. I mean, the exciting thing about breast cancer is that, we're lucky to have a lot of awareness around it, and that generates a lot of research. And sometimes it generates a lot of confusion too, because it's how do you apply that. So just the way that we talked about gene abnormalities being an umbrella term, breast cancer is also an umbrella term. So someone who's diagnosed with breast cancer may be diagnosed with anything from a very early indolent or slow-growing, non-aggressive type to something that's very aggressive.
Right.
So, when you're looking this up in the early days, it's important to kind of take a step back, and talk to your doctors, because you really want to understand where you fall on that continuum.
And we hate to cut you off because we have to go right now, but when we come back, we're gonna talk more with Lori about breast cancer awareness. We're gonna get more into the treatment.
Right.
I have some other questions about mastectomies too.
And guidelines as to when to have that first mammogram.
Great.
Yeah.
All right, we'll be right back.